Hello everyone, welcome to the video podcast series from One Lattice. My name is Sanjay Sasdeva. I work as Senior Vice President, Healthcare and Life Sciences Vertical at One Lattice. One Lattice is a tech-enabled next-generation market research and insights advisory and business consulting organization. And today our topic of this video podcast is wound care market in India, key challenges and opportunities. And to deliberate on the same, we have our distinguished speaker, Mr. Vivek Mishra, who is the founder and CEO of Fibro Heal Wound Care. Fibro Heal Wound Care is based out of Bangalore but has pan India presence. And Vivek has keen interest in science and engineering of biomaterials and the healthcare applications of the same. And that also includes innovative solutions for acute and chronic wound management, which definitely helps to improve the quality of life for lot many patients to a great extent. And Vivek, I believe this journey as an entrepreneur for this innovative startup, Fibro Heal Wound Care, must have been really exciting so far. And it's great to have you today, and we would like to learn more from you on this, segment of wound care market in India. So over to you.
Thanks, Sanjay. Thank you very much. And namaste to everyone. Uh, Sanjay has introduced me and FibroHeal, and I'm glad, to be the part of FibroHeal and the way we have evolved ourselves from being the first company to have commercialized non-textile biomaterial application of silk to heal various types of acute, chronic, traumatic, and post-operative wounds. And the aspiration to become a comprehensive wound care company addressing all types and stages of wounds, and slowly and steadily how iterations happen, how various failures happen, which later on turned into the stepping stones to succeed. And so happy to be speaking to One Lattice and Sanjay.
Thank you, Vivek. So, firstly, we'd like to understand, wound care market in India is a pretty big one as per, various data points suggest, and our country's population and the incidence of the acute and chronic wounds are also very high. So, what is your take on that in terms of market attractiveness? What kind of various stakeholders are there? So, what has been your experience so far?
As you rightly indicated, wound care market is fairly large in India. And if I have to put a number to it, I will put a number of about $300 million. That is about 2400 crore. That has spread across various usage. One of the challenges what we have seen in wound care market is consolidation, which has not happened, which particularly we see in sutures market. Although sutures market is comparatively small than wound care market, but it has consolidated, and that's how we see that suture is much more successful. So, and wound care market, there has been no flag bearer. There have been few multinationals who have been trying to do it, but then you have players who are operating from different space in local region, in 2 states, 3 states, 4 cities, that kind of thing. So I see there is a huge opportunity to be addressed, and the important part is to have the patience, perseverance, and offer solutions which delivers what it claims. Because wound care is something which is more of a service and less of a product game. And when you see, I will relate it to something like, how pharma operates in acute and chronic space. So wound care is mostly on the chronic side, and that has always been ignored. And there is data which also backs it. India has got about 8 crore diabetics and 7 crore borderline diabetics, or rather reverse, 7 crore diabetics, 8 crore borderline diabetics. 30% of them at some point of life, some point of time in their life, goes through process when the wound is not healing. Now you know what is the size of opportunity in one area. Similarly, there are a lot of cases, where patient develops bed sores, various types of ulcers, and other kind of thing which is unaddressed. And at the same time, also the cesarean which is happening in the country. So that way, when we look at, but no one has come up with, product range or, an innovation which can address all these areas. And that's what FibroHeal identified, and we have been slogging it out to ensure that we are able to reach, and, as a homegrown company, and, having seen the journey and having understood the grassroots realities, we aspire to be the biggest player in wound care in India someday. And the plan is to keep your head down and keep working, do the good things, and that will definitely happen at some stage.
Yeah, I think you have given some interesting analogy with the pharma segment as well. I also just wanted to understand from you that as you rightly mentioned, it's a big market, almost 2,400 crore rupees or maybe 3,000 crore rupees. But still, over these many years, in spite of multinationals being present and innovative Indian companies like yours in this space for last 5 6 years or more, still the pie looks like more in the favor of traditional wound managements like cotton gauzes and traditional dressings. If I am right, then you will agree that almost 80-85% is still traditional methods are being employed. So, what is your take on that? I mean, why the situation still is like that, and how do you see this, advanced wound management methods gaining more traction?
Yeah, that's a very valid point what you have touched, Sanjay. Wound is often ignored. It holds the least importance when it comes to the treatment and the management of wound. That is one of the reasons, because even you won't find hospitals who are very serious about wounds. Of late, you will see from last 4 5 6 years, people have become understood the repercussions of it, and they have become serious that how life threatening a wound can become at some stage. Now coming to, yes, we are 5 6 years old in the company, but no, as I mentioned in the first during first discussion itself, that there has not been any flag bearers and no one has worked in a focused manner. I agree with you. More than 60% of the wounds are treated with traditional dressing, that is gauze with povidone iodine or some kind of thing, and they put it. And one of the aspect, important matter, why it is done so, is the lack of awareness. Point number one. Second, not having enough option. Third is the price point, and fourth is the companies or the industry driving it. So these four parts are missing, and that is the reason why wound care space is not taken off. Now let's take an example: a diabetic foot ulcer. Whatever povidone iodine you put or a normal gauze you put, you know that the wound is not going to heal. But at the same time, if you deploy the right methods, it will take, say, if, for example, if you look at negative pressure wound therapy, it was expensive. But today you see that even tier 2, tier 3 cities, and with various kind of services coming in, various companies, KCI, which now part of 3M, you saw that they were giving a service in the area of 280 kilometers. Say, guy sitting in Chennai will serve an area around 280 kilometers radius. That kind of services companies has to come up, and wound care companies are not has not been able to derive it. Secondly, the way of promotion is not typical pharma. It is slight knowledge driven, and you need to make your hands dirty. You need to show dressing how it should be done. And that is what I think, if on the education part, if wound care companies focus and give it time, definitely this market has huge potential, because each data says a different number, whether 2,400, 3,000, 4,000, whether it is at the company value or at the distributor value or at the MRP, that value will change accordingly. But
Yeah.
what we know that there is an opportunity, there is a path, there are solutions, but right now, due to unawareness, the new group of surgeons who are graduating now, they are able to see various types of wound and they have some interest. But what was the earlier generation, they have still not put their hands too much into wound area, and that is the reason why it has not been able to take off.
Very interesting. I think you have touched upon a very valid point that lack of awareness and the uh, as new surgeons, as you mentioned, they are coming up with the lot of information because companies have been reaching to them. So, if we particularly talk about the education per se, uh, like doctors, definitely the surgeon, a plastic surgeon or adaptive foot surgeon or a vascular surgeon, they are the major stakeholders. But apart from that, what all you feel, is still uncovered in the ecosystem when it comes to the stakeholders, and how the organization should ensure that a proper awareness is being percolated from doctors to the paramedics or other stakeholders which you feel are important in this
Yeah,
segment.
yeah. Sanjay, one of the important aspects is, in wound care space, there has been no marketing, more sales. Marketing is always, marketing means sales in wound care, and particularly if you see, you need to build those brands by education. So for that matter, you have to educate people about various types of wounds, what it takes to heal them, and or get involved at doing various types of activities, not just CMEs, but get into roundtable meetings, focused group meetings, peer-to-peer competitions, how you have hackathon kind of thing. Some those kind of innovative things should be implemented at grassroots medical college level. And wound care as a subject through policy should be brought into where people give equal importance like a specialty. And this will also be amazing if a specialty called wound care is created, which in many hospitals we notice that there is specific wound clinics which are there, and any specific surgeon will look into it, not just plastic or a general or something, but people, that is the kind of education we need to get into. At the same time, how a product will be used. You realize that you have got a paraffin gauze or a normal gauze. Please understand, when you are dealing with a gelatin based dressing, it is different. With silk, it is different. With a cellulose based dressing, it is different. With collagen, it is different. For example, collagen will be with IPA. You have to dip it in saline and then apply it. In case of gauze, it is just to cover. And then there are three types of dressing: traditional wound care, advanced wound care, and active wound care. And right
Yes.
now people put it in simple category ki haan yaar patti karni hai, but that is not how it should be. So what I say is it will take another 5 to 7 years before the wound care market, people are aware about the new developments. We see that most of the people are aware about negative pressure therapy today. Similarly, products of Integra and various other cellulodermal matrix has also come into foray. So I see that there is lot of improvement which is happening. Of course, penetration in tier 3 and tier 4 cities would be the key. Tier 2 we know that people are aware of due to thanks to social media and various e-com and other things. Also, one area which I feel is how pharma companies deploy more fit on the street, engaging more through digital channels, involving in through digital channels, and doing some research and doing some market research and then getting into specific market. That go to market entry plan and those things will help. And I'm sure in next coming 5 to 7 years we'll see a lot of innovation happening, and we'll see that the wound care market will suddenly grow multifolds.
Yeah, that's interesting. As you also touched upon the medical colleges, particularly the government medical colleges and the government policies. Like just an example, in UK and other mature markets, there are specified tissue viability and wound nurses are there. So no such specialties of wound nurses is in India. So have you ever thought of or already reached to the government agencies to create certain courses like you also talked about, and collaborating with the consortium of different wound care organizations to make this a possibility? So what is your views on that?
Yes, I absolutely agree with you on this that a consortium kind of thing is needed, but that will come when there is a leader. And there is a wound care market company which is leader, which is education driven and not sales driven, who is there to not just with the numbers but a mission to build this up. That's what generally happens, when people will join the journey and things move. So I agree with you that this is needed from the policy side, and also it is needed to actively participate and engage in a lot of collaboration, cross collaboration, when there is no conflict of interest, rather cutting each other out, finding ways to help each other out. That should be the strategy to ensure that wound care market matures, and then everyone wins and
Yeah.
the best product and services can be brought to the countryman.
Agree, because we have seen, in particularly in the pharma segment is kind of more structured and well, they collaborate a lot. So I think such collaborations can also be helpful, because there are not many wound care organizations, but yes, they are increasing. But then such collaborations can be really helpful to expand this market. Uh, you also touched upon, reaching out to the patients who are in the smaller cities like tier 3, tier 4, or even the rural markets. So how to what is your views that how can these products made accessible in those markets? Because prima facie, so far the wound care products are more concentrated in metros or tier 1 or maximum tier 2 towns. So what is your thought on that?
So, in the first answer we mentioned, price is going to play a key role. So, as a company, right now, if you want silk protein, I have a dressing starting for as low as 4850 rupees, going up to 5000 rupees. So important aspect is you need to offer a product at various price point and depending on the kind of wounds. Probably NPWT will find it difficult in a tier 4 city, that affordability and various kind of thing. But you can always find something which can address that area. Similarly, for specific type of dressings, smaller wounds or post-op or C, these kind of things can be looked at those areas, and that can help you address it. Also, one of the other things will be to participate with various government initiatives. If you are able to partner with various government initiatives, various Anganwadis and those kind of things, and make people aware about the challenges. Also, lot of initiatives can be done to educate people about early detection of some of those wounds which later on becomes complicated, food screening and those kind of things. And the companies who wants to build it up and have a plan to play the game for a decade, they have to basically, market development is something where companies need to invest, and for that they can deploy various agencies to do the market research for them, or that kind of thing, and come up with solutions, and then ensure that this many activities happen. You are able to identify things, and those things will help you to grow the market and make people aware, and then you will reap benefit over a period of time and help people in the process. So that those are some of things what I can think of.
Yeah. So, uh, also would like to touch upon the patients. Basically, they are the ultimate, sufferers. Chronic wounds takes months or years to heal, and though many organizations have patient support programs, so what do you feel? I mean, in terms of the impact of those patient support programs, and how FibroHeal is contemplating on such patient support programs, and what kind of initiatives you are working on. So just want to understand that as
So
well.
one of the important aspects what in FibroHeal we follow is, before selling the product, you should know the product, and you should have used the product on certain number of patients. So that is one clause which that's why we are very selective about hiring people in the company. And those who are hired, they know how to do the dressing, which dressing is needed, and in the case of certain this thing, they are able to demonstrate it. So that is one clause. Of course, we are doing it at a very small level, being a startup, and being on the path of being a big company. But at this stage, we are operating at smaller level. But it will be a wise idea to have a separate market development team supporting sales team, whose role is more of activities, awareness, and helping the patients. Also, you need to have, many companies have patient this program, touch basing upon the patient program. Right now, we follow the direct method, where we ask the patient to send the photograph, or we offer the second opinion. If someone have this option to, someone has been advised an amputation, we ask them to send their photographs or image to us, and we have a full-fledged medical team. We have got a few surgeons on board, and they advise us what is the best course forward based on the HD images and the reports what we have received. And that is all free of charge. As a startup company, this is a big service what I am offering, because those surgeons has to be taken care of. But these are small initiatives what we have taken. But as you said, once the company have good amount of budget on these things, and who has the aspirations to have the market leader, they have at some stage or the other, they have to allocate funds to get into this thing and do a lot of market development related activities in the help of patients. And patients have many doubts. To forget that more, not only just wound healing, they also need a lot of psychological support at that stage. So they should not ignore that part also. So if you are able to provide psychological support along with that wound healing support, I'm sure the patient uptake, or the wounds, the way it is right now, the condition is, the things, how bad it looks, it can be addressed in a much professional, much better manner. And of course, a couple of questions back when you indicated about nursing staff who are aware, who are trained in nursing staff, those things will help. So these are some of the things what according to me will help.
Okay, very nice. I think you have touched upon a very important aspect of the market development. Lastly, I would like to understand from you, where do you see this market moving in terms of the growth in next 5 years? And how do you see fibro heal also making a difference in that?
So I see market growing by another at least 50% in the next 5 years. And I also see that Fibro will be among the top three names in wound care space in India in next 5 years. That is the aspiration what I'm looking into. And this is based on the range what we have, the kind of research pipeline what we have, the kind of response we have seen with the products in terms of saving various limbs as well as healing various types of complicated wounds, including various types of wound adhesions and other kind of thing. So I see that it's not an easy path; it's a tough path, but there is an opportunity, and those who aspire they have to work hard to ensure that the opportunity is utilized and the benefit is passed on to many people, patients, surgeons, employees, and the people of the country, and that way, and to science and innovation, not to forget the science and innovation, and that's what will unfold various other things. So I see there is huge chance the market is going to grow. This is the ideal time to be in wound care space, but patience, perseverance, good intent, and keep on innovative and ensuring that it is at the right price point is what will help you to succeed. Those
Yeah, of
are
course. I think price point is also important because mostly it is an out of pocket market and price sensitivity is there. So definitely, if the organizations are offering the solutions at a right price point, so that should definitely have a lot of patients and masses as well. So thanks a lot, Vivek. I think it has been a wonderful session with you. We have got a lot of insights from, because you have been into the battlefield for quite some time and you have yourself experienced the challenges and definitely what kind of opportunities are there. So I believe this will be a very beneficial session and a lot of insights have come through this. So thanks again. Thanks for your time today. And we'll catch up again. Thank you.
thanks, Sanjay. Thank you, one lattice, and namaste to everyone.